would agree that the federal government has ballooned into a monstrosity that not only would shock our founding fathers, but also that local governments or hardly anything else can even be compared to. So we're talking about local government. Although that's a core belief of mine, I believe that law should only be created by the legislative branch or the people. But based on the laws that are on the books right now, the state of Tennessee disagrees when it comes to boards of health. And we're here tonight because back in the spring, most of us who even knew that there was such a thing as a board of health felt that those boards of health existed to provide a measure of oversight and fiduciary oversight over the health department and to act as an advisory board to the county. Well, we all learned, or many of us learned, that health boards actually have been given much broader authority by the state, and in many ways, kind of unlimited authority. And that set off some alarm bells and red flags in a lot of people as a matter of principle. And so, I say that to say that I can support this resolution. Now, I'll qualify that with this. I'm a strict constructionist when it comes to the Constitution and to the rule of law. And under the rule of law, a county is a subdivision of the state. Counties exist because the state that they are in says they exist. Counties are not sovereign. States are sovereign, or at least they were supposed to be when it all started. And so a county cannot make a law that conflicts with state law. However, this resolution in its final form does express desire and intent, not creating a law or a mandate, and so I can support the resolution as it's written because of those principles. Thank you.
Thank you, Commissioner Bueller. Commissioner Biggs.
Thank you, Chairman. Man, Richie Bueller, you're all right. That was good stuff. I ain't even gonna lie. I'm impressed. I feel the same way you do, brother. But I feel a little bit more. I'm a little bit more passionate because Dr. O'Brien, I've never had the pleasure of meeting you, and I really do appreciate everything you're doing, but I hear a whole lot of I and not a whole lot of we. And the direction that I want to see the Board of Health go is the direction that I feel like my constituents want as well. And while I do appreciate you, heard a lot of infringing upon my freedoms and things of that nature tonight, a lot of data. And I'll be honest with you, other than the CDC and some other areas, I don't even really know where you guys are pulling your data from. I heard Commissioner Smith talk about taking a stance on underage consumption. I've heard a lot of different stances. But whenever I met with Director Buuck, Law Director Buuck, sorry, I started talking to him about a resolution that I wanted to craft that I felt like would find medium ground. And boy, I've got some of the nastiest, most hateful emails and phone calls ever, and I've come to the realization there's not a medium ground. It doesn't exist anymore. It's either one side or the other, and that scares me sometimes. I feel like with this resolution, it's the best that we can structure to put out there, but whenever I'm hearing everybody talk, I have a couple questions. After the state emergencies are over, Director Buuck, what happens to the Board of Health's powers?
Board of Health powers will still exist.
Exactly. If the Board of Health decided that sugary soft drinks weren't good for us, could they mandate that you can't buy sugary soft drinks in Knox County?
Let me read to you, so as I have been misunderstood by the press and one or two commissioners on what I said at the last meeting, so I'm just going to read from the statute, okay?
Thank you, Director.
Question was if, I guess you're referring to what they did up in New York City where they banned the sugar drinks. So I'll answer that by giving you from the statute so there will not be any misunderstanding. The Board of Health, under the statute, can adopt rules and regulations as may be necessary or appropriate to protect the general health and safety of the citizens of the county, period. They have that broad authority. There's no limitation on that authority. And as Commissioner Bueller pointed out, there's no answerability. The federal agencies When they do a regulation, they are required to follow the Administrative Procedures Act. They need to publish that to the public. The public gets a chance to put in their say-so on it before that regulation ever becomes law. And that agency, whether it be the FDA or whatever it is, has a head who is appointed by the executive, the President of the United States, and is answerable to that. So there is answerability. It's not just the legislature set this up, we live with it, we can't change that law, but that's the broad power to answer your question, Commissioner.
Thank you, sir. With that being said, I've looked over this, and basically there's no limitation on the power of the Board of Health as long as they say that it's the safety. Is that correct?
In their opinion, if they can adopt rules and regulations as may be necessary or appropriate to protect the general health and safety of the citizens. That's the law.
Thank you, sir.
Commissioner Ward.
I just had a follow-up on what Commissioner Biggs asked to make me think of another question along the same lines. We, at last commission, we had a lady speak very passionately about the gun murder rate we've been having in East Knoxville. Could the board, in theory, say that we have a gun problem and banned guns to some degree?
As broad as this is written, and if you follow what people across the country are doing where they're saying guns are a safety hazard and they want to cut down the limitation on guns and all of that, it's arguable that what I just read is something that would fall within the province of the Board of Health.
I'm coming over to you, Commissioner Smith, but I'm